All right, let's talk about inflammation. When you hear that word, what's the first thing that comes to mind? Probably something bad, right? Something you need to get rid of. But what if I told you that's not the whole story? Today, we're going to look at inflammation for what it really is, your body's ancient, built-in emergency service. It's the first responder kicking into action every single day to protect you. I mean, just think about it. Something as simple as a paper cut, the kind that really stings, or getting a tiny splinter, that immediate little reaction. That's actually the opening scene of an incredible biological drama happening right under your skin. It's the silent alarm that triggers this massive, perfectly coordinated response from your body. And here's the most important takeaway. Inflammation isn't the problem, it's the solution. It's your body's internal 911 call. It has a clear three-part mission. First, take out the threat, whether it's bacteria on that splinter or just your own damaged cells. Second, send in the cleanup crew to clear out all the debris. And third, get the construction site ready for repair and healing. It's a good thing. So how do you even know this whole emergency response is underway? Well, your body is actually pretty great at communicating. It sends out these very clear, very obvious signals. And these aren't symptoms of a disease, not in this case. They're the flashing lights and sirens, the physical proof that help has arrived on the scene. This whole process gives us what are known as the 5 cardinal signs. The redness and heat, that's not a bad thing. That's the superhighway of your bloodstream opening up, widening the lanes to rush more blood and more help to the area. The swelling happens because those blood vessels become just a little bit leaky on purpose, creating exit ramps for your immune cells to get out of the bloodstream and into the tissue. Pain? Well, that's the alarm system screaming at your brain, hey, pay attention, we've got a situation here. And finally, that loss of function. That's just your body being smart, telling you, hey, maybe don't use that finger for a bit while we do some critical repairs. Okay, so that's what we can see from the outside. But now, let's zoom in, way in, because the real action, the real drama, is a microscopic battle happening between your cells. This is where your immune system literally sends in the troops. And who are the first boots on the ground? Meet the neutrophils. In this short-term acute inflammation, these guys are your special forces. They're fast, they're aggressive, and they are built to get to the trouble spot in a hurry and just start neutralizing threats immediately. They are the definition of a first responder. And the journey these neutrophils take to get there, it's like something out of an action movie. Seriously. First, they have to catch and roll along the inside of the blood vessel, kind of like they're grabbing the wall and tumbling along to slow down. Then they get a chemical signal and they stick tight right to the wall, parking themselves next to the exit. After that, they do this incredible contortionist act, flattening themselves out to squeeze through tiny gaps to get into the actual tissue. And finally, they follow the scent, a process called chemotaxis, basically sniffing out a breadcrumb trail of chemicals that leads them straight to the battlefield. It's amazing. So, the first wave of attack is over. The immediate threat has been handled by the neutrophils. But now what? The fight isn't totally over. Now the focus shifts to the aftermath, the cleanup and repair. And what happens next really depends on how bad the damage was and how well that initial fight went. There are really 4 main ways this whole thing can wrap up. In a perfect world, we get complete resolution. Everything is cleaned up, the tissue goes back to normal, and it's like it never even happened. Now, if the battle was really intense, you might get fibrosis, which is basically a scar. Sometimes the body just walls off all the gunk, the dead cells and bacteria, and forms an abscess. But then there's that 4th possibility. What happens when the fight never ends? What happens when the alarm signal just gets stuck in the on position? And this, right here, is where the story takes a dark turn. This is where our hero, that protective inflammatory response, can actually become the villain. We shift from a short, sharp battle to a never-ending war. We enter the dangerous territory of chronic inflammation. The key to getting your head around chronic inflammation is that one phrase, all at once. It's this destructive, vicious cycle where your body is constantly trying to attack a threat, and that attack is causing damage to your own tissues. But at the exact same time, it's trying to heal the damage it's causing. It's an exhausting, damaging stalemate that can go on for years. I mean, look at the difference here. It's stark. The best analogy is a race. Acute inflammation is a sprint. It's fast, it's intense, it's all out, and it has a clear finish line. The neutrophils are your star sprinters. But chronic inflammation, that's a brutal marathon with no finish line in sight. It lasts for weeks, months, even years. And you have a totally different team of cells running the show, like lymphocytes and macrophages. The goal is no longer clear. It's just a long, drawn-out war of attrition. So what could possibly cause this emergency state to become permanent? Well, sometimes it's an infection the body just can't get rid of, something persistent like tuberculosis. Other times, it's an autoimmune disease, where the body's alarm system gets confused and starts attacking its own healthy tissues, like in rheumatoid arthritis. And sometimes it's just being exposed to a low-level irritant or toxin for a very long time. In all these cases, the off switch for inflammation just can't be flipped. And all of this leaves us with this one huge, fascinating question. Inflammation is this ancient, life-saving mechanism that has protected us for millennia. So why then is it now linked to so many of our most modern diseases? Heart disease, diabetes, and so many others. Understanding this double-edged sword, how our greatest protector can also be a source of chronic illness, is truly one of the most important stories in medicine today.